So with respect to disclosures, I am a current PI for an Allergan study on the use of hydrogel, not directly related to this study, and this trip was self-funded. So this is basically a post hoc analysis of multiple randomized placebo-controlled trials that were done by Allergan looking at the use of Onabotulinumtoxina 100 units, which have shown significant improvements in urinary incontinence and quality of life in patients inadequately managed by anticholinergic. Again, we sought to understand better the impact that both disease duration as well as BMI might have on outcomes. So this is a pooled post hoc analysis undertaken to evaluate the efficacy and safety of Onabotulinumtoxina 100 units according to baseline OAB duration and BMI. So study design, again, the key inclusion criteria listed there to the left. Patients were screened and then randomized either to Onabotulinumtoxina 100 units or matched placebo. Again, 3 phase 3 studies and then 1 phase 4 clinical trial. So what we saw here with results, substantial reductions in urinary incontinence episodes daily, 12 weeks after treatment with Onabotulinumtoxina. So to the left, you see the OAB duration divided up into less than 2 years, 2 to 5 years, and greater than 5 years. And as you can see, the change from baseline, pretty similar across these 3 domains. And below, you can see the actual number. The mean change from baseline in episodes is about roughly 3. And then to the right, you can see the BMI classifications there, less than 25, 25 to 30, 30 to 40, and then greater than 40. Again, pretty standard across. So looking specifically at greater than or equal to 50% reduction, as well as 100% reduction, which would be the dry rates. So on the left, OAB duration. Again, you see a little bit of an improvement with less than 2 years. But then again, you go to 2 to 5, greater than 5 years, and you see significant improvements in greater than or equal to 50%, as well as the dry rates, which approach 28%. Moving over to BMI, again, looking straight across, you've got pretty similar reductions, greater than or equal to 50%, as well as dry rates that are pretty equal over there as well. With respect to quality of life changes or improvements, what we found, again, looking at OAB duration and BMI, were significant improvements in the King's Health questionnaire role limitations and the social limitations. And these are basically 4 to 5 times the minimally important difference with Onabotulinumtoxina evaluated 12 weeks after treatment, looking at OAB duration to the left and then BMI to the right. With respect to looking at clean intermittent catheterization, a very low incidence across, again, all the subclassifications for OAB duration as well as with BMI. And then looking at adverse events in the first 12 weeks after treatment, again, the most common adverse event was UTI, and pretty similar across, again, all the domains with respect to OAB duration and BMI. And then below, at the very bottom, is the urinary retention rates across those domains as well. So in conclusion, this is a large cohort of patients with overactive bladder, inadequately managed by anticholinergic. We saw consistent treatment responses with Onabotulinumtoxina across all OAB duration and BMI groups, with no clinically meaningful difference apparent across the groups. The improvement in urinary incontinence was accomplished or accompanied by clinically meaningful improvements in quality of life, which I showed, and there were no unexpected safety signals observed. The risk of CIC following Onabotulinumtoxina treatment was low, regardless of either OAB duration or BMI. Thank you very much.
Thank you.
Questions?
Please.
Dr. Wag.
Adrian Wag, Edmonton, hello. Did you correct for age? Because clearly it tends to be the middle-aged and duration is confounded by age. And secondly, what was the hypothesis you were testing around the BMI thing? Just a fat person's bladder, is that worse than a thin person's bladder?
Yeah, so with respect to the second question, there was some discussion in the community about whether or not obese patients were more prone to have voiding difficulty issues with Onabotulinumtoxina.
Because they can't find their willy out of their trousers? Or
Well, that's certainly one thought, but, whether or not there might be something more prone to them having voiding issues or bladder emptying. So I think this was undertaken to really try to figure out specifically if that played out, and as we saw with the BMI, we did not. So, and with respect to controlling for age, I don't recall if that was.
I think it would be worthwhile.
It would be worthwhile.
And the only other thing was, is there a difference in duration of effect with either BMI or duration of prior disease?
Yeah, that's another great question. I don't think that was looked at specifically in this analysis. So.
Thank you.
Or if it was, yeah. Next question.
Are those patients with the Botox injection received any anticholinergic while they are taking the Botox injection?
No, I believe all these patients came off drug therapy while they were getting just the Onabotulinumtoxina.
Yeah, because in a clinical practice, most of the patient, not most of the patient, they receive a Botox injection, but we continue the anticholinergic medication even with low dose if the patient is not satisfied.
Right.
Yeah.
Excellent.
Yeah. So in your patient, could you identify what is a predictive factor for the success for the injection?
Yeah, again, this was specifically designed to look at disease duration and BMI. As far as predicting for success, other papers published in the literature have sort of gone through some of those variables with respect to what that might be. But that wasn't looked at specifically here.
Okay. Thank you.
Great. Thank you.
Thank you. So next